There are many cosmetic treatments that can make a bride, or a mother of a bride, or a groom for that matter, look absolutely great on the wedding day.
But our next guest advises be realistic about your expectations. So joining us now is Dr. Mark Blake from the Clinic of Cosmetic Surgery to talk about different facial procedures and perhaps find just the right one for you, right, Doctor?
That's right.
Welcome to the Morning Blend. Good to have you here.
Nice to have you.
You too.
I think a lot of people want to obviously look their best on their wedding day, whether you are, again, the mother of the bride or groom, the actual bride or groom, or even just somebody just going to the wedding.
Right.
You want to look your best. So facial procedures, things like that, are pretty popular before a wedding, I would assume.
Absolutely. Becoming more and more popular, obviously. One of the biggest things that we always want to be on the lookout for and help educate people is not to necessarily come in the day before the wedding.
Right.
You know, that's extremely important. Everybody wants to come in a week before the wedding and we'll have a facelift. Well, you know, that's not exactly the best time frame to do that. So
That's when you should be getting your nails done, not your face
Right.
done. How much time should you give yourself when you're looking at doing some sort of procedure?
Well, I think the best thing to do is to, as soon as you know that that date is coming, you should come in and have a consultation. It really depends on what you're looking to have done. You know, there's simple things from just makeup that you may want to do the day of or the day before type of procedures versus, you know, something more like a facelift where you're going to want to do several months beforehand to make sure that everything is properly healed and ready to go before the big day.
I was looking at a list of some of the different types of procedures that you provide, and I bet a big part of what you do is educating people, you know, because they might say, well, this bothers me when I look at my face, or these frown lines, or whatever it is, and you help them decide then probably what procedure is right for them. But some of them include, you know, full face lifts, right? So you probably go from something that's a little bit more extreme all the way down to, you know, smaller procedures where there's not much downtime.
Right. And it really depends on the person. And like you said, I think education is vitally important, and that's one thing that I really emphasize. Our consultations are free, and so we want to get people to come in and to educate them. There's lots of different things that you hear about on TV or on the internet or radio or what the celebrities are doing, and while that may be great for them, it's not necessarily great for everybody. And so what's important is to come in and really find out what are all the different things that are out there. It's not just a cookie cutter type of a procedure. What's right for you may not be right for you or me. And so to come in and find out what are the different things that we can do, find out which one is best for that individual, and then plan what results do you want to get, and what procedures are going to get you to that final result, and so that we don't just do a facelift on a 30-year-old. You know, not everybody needs a full facelift. It might be something that's very minimally invasive or non-invasive completely that's best for you.
Like laser resurfacing even, I know is really popular. You also have like fractionated laser resurfacing, ultrasound and thermage we've heard of. I know you do those procedures as well. Right.
They're all different procedures that are a little bit more non-invasive. Not everybody wants to have a complete facelift, and that's fine. There are other non-invasive procedures that may give you some improvement, while they may not get you those same results as a facelift. If you're not ready, you're not ready, and so we don't want to push any procedure on anyone. So there's alternatives that are available for people to seek out and try. And it's our job to really sit down with you and say, all right, is this going to do anything for you or not? You know, we don't want you to waste your money on something that's not going to work, and the general public doesn't know if that's going to work on them or not. So we want you to come in and let's go over it and find out, and let's talk about the different options that are there.
Absolutely. And I think it's important that you say you should also find out what someone is certified in terms of the doctors, not just the fact that they're certified, but what they're certified in. So that's part of that education process.
Right. It's extremely important. You know, we at our clinic are board certified plastic and reconstructive surgeons, and you want to find out who's doing your surgery. You know, is it a plastic surgeon, or is it somebody who's certified in, you know, mechanics? You know, what are they certified in? It becomes important. You know, I don't want my refrigerator man, you know, remodeling my house. You know, it's just
right.
You know, it becomes important.
Absolutely. What is the liquid lift?
The liquid lift is a newer procedure out there where part of the aging process is we're losing volume within the face. And when you lose the volume, the gravity can take over and everything starts to descend downward. So one of the treatments that we can do is to revolumize the face with either a synthetic filler or sometimes using fat to help revolumize that face up and lift the face up. Again, this is one of those procedures that can be done under local anesthesia with very minimal downtime. So for some individuals who aren't really ready to go, ready to go under a knife or have a major downtime, this is an alternative type of a procedure. Again, it may work for you. It may not be the best choice for some individuals. So again, that's where it becomes important to come in and find out if that's the right procedure for you or not.
Absolutely. I do like the fact that you offer everything from the, the surgical to more of the non-invasive.